I'm going to that. You have a question about it. And he, I'm even more choosing a worry. We plan to the both of us.
Thank you very much, Pam, for connecting us in. So Pam's running the session from there, but I'm running the session on my machine to actually record it because I don't know how to actually gain ownership of this system. So, and it's recording now, so you don't need to remind me.
Okay, good job. That sounds good.
See if we Cool. So we've got about 25 different people from all over the place coming through.
I was going to ask you because I've got a similar thing happening immediately after this in the city.
Yep.
So I said, well, I can't possibly be there because we haven't got teleportation yet. Can I use the phone in here, or will the room be used?
It'll be me. I'm moving into it. Depends on how long you need the phone.
It'll be typical 3.
Yeah. Now that'll be. I've got a meeting for this. The same. Well, 2:30 I think I did. So I might be able to skip out and sit outside. And you can.
No, don't you disrupt what you're doing. It's just that I thought if you do it on my mobile,
yeah.
It gets, it's like having a bloody iron up at your ear if you're on the phone for that length of time. Right, so.
Yeah, I'm locking at 2:30 to 3:30.
Oh, someone in Malaysia.
Yep.
Saris isn't there yet. Oh, is that Saris? No.
I think she's logged in, so I think that might be her.
No. Maybe she's.
Oh no, she's not got the image on.
Sorry, I introduced me. My opponent.
That's right.
Why don't you add God? I don't even get the names in.
So you can press the down arrow. We've given you that incredible job.
Great. I am the changer. I'm good at that.
I'm just saying I'm breaking the tradition and reading from the script just a little bit. I don't like doing it if I've got people that I'm actually talking to.
Yeah, no, that's fair
We
enough.
don't count as people, do we?
Subhuman. Subhuman.
You're just here to give me moral support, aren't you?
We're here to learn.
That's right. Yeah, I'm looking forward to this actually. I don't know anything about this stuff.
You'll know more than you think.
I should know more than I think. Do you want us to sit anywhere in particular?
No, whatever you want, mate. The only thing is you can't be any further away than that.
Yes.
Because I tried further down the table and it didn't work.
Cool. Great.
I'll come up here.
Great.
Oh, it takes a lot of organisation, doesn't it?
Well, this one's a lot easier than the previous version, where it took me 10 minutes to link each node in, and that was Pam Miller having to do all that work. That was hell.
That was hard. And Matthew did all of that. Like, that was back in the day when you did everything. That was a lot of work.
Yeah, well, now we've got a lot more flexibility. We don't have to have university web video conference rooms.
Right, yes.
So people are sitting in their offices,
Yes.
and that makes it much more
Oh, yeah.
doable.
So there'd be. Suppose there's not more people.
Yeah, we're still a bit
Still
over.
quarter to.
True. Just keep checking.
So all the little faces come up on here.
Yeah. But you can't see every little face. It doesn't get smaller and
No.
smaller. So what will
You
happen
can
is
only have so many
yeah,
nodes.
and when somebody says something, they appear up on the screen in a large.
I'm just going to check my email because sometimes people email at the last minute.
How's life otherwise with you, Matthew?
Well, you've gotten me out of half of the management committee meeting for the Hazelwood study, so
Oh, I bet that's good.
I'm pleased with that. Yeah, it's been very hectic. We've just lost a couple of staff members, as happens on big studies in the early phase. So we're trying to line those new people up. But once that settles back in, we've got one replaced already, and she's good. And the next one looks like she'll be good as well. So, we'll be better off in the long run. It just takes time.
His CQ, that's
Yeah, the CQU's got multiple people,
good. Yeah.
so that just double our audience.
It's warm in here.
Anything's cooler than yesterday.
Yeah, I got a nasty shock. When I went to work, I'm like, oh, it's going to be pretty warm. And then I came out of work at like 6:30. I'm like,
Yes, it really changed, right?
Well, I went in shorts and short sleeve shirt, and it's like 5 o'clock.
I was one of those people
Taught me a
actually.
lesson. So I'll speak for about probably 10 minutes, going through some era stuff and so on.
Yes.
And then I'll kick off. So,
Okay.
and then,
Hello, how are you?
well done.
Now I've got Lynn again.
Yeah.
Hi there.
Don't believe I'm here, Matthew, but there you go. I managed it.
You did, well done. So we've still got quite a few more people to log in, so we're just taking our time until people turn up.
Lynn, did Barbara get in touch with you?
Yes, she's on her way. Thank goodness,
Right.
yes.
Good.
Hello, Matthew speaking. Not too bad, mate. Yourself? I told Michael that you don't actually have a booking there.
Did you get a park okay?
Yes. Good. It was easy with the thing.
Phew. I've heard that it can be, so.
Well, that's what I would anticipate.
Even I've heard even with a permit, it can be, but probably at this time in term, it's probably just on Monash the first week is even with a permit, it's difficult.
Matthew was saying he didn't have your copy with the colour cartoon in it.
Oh, really? I sent it to him yesterday.
Well,
Did you get
obviously
the
I
email?
got the PDF. Yeah.
You got my email.
Yes.
Yeah.
So the person I sent an email about in Churchill to say don't turn up at Churchill, turn up at Churchill.
Oh,
So you can just show that, can you?
Oh, I haven't got your have you revised the presentation?
I sent it to you yesterday.
Did you?
Yeah, I did. But I can send it to you again.
No.
I just need to get on. Now, why would I not be able to get on?
Where is it?
You were BCC'd. I'm sure. I included you, didn't I, Jane?
I got the email
I
back
got,
saying you were
I got
going.
it. I got the PDF.
Yeah.
I got the PDF and the references.
Because we. Here we go. Let's read.
So you give me the PDF, but no, that's a reference list. Yeah, so I don't actually have the PowerPoint presentation.
I usually use the PDF.
You want to use the PDF?
But
That's
I'm
fine, yeah.
super happy to.
No, that's fine.
I've got the PowerPoint here.
No.
Do you want me to?
This is going to be
G'day.
sitting down.
Yeah.
I'm not used to
Almost
sitting
too
down.
comfortable.
Anybody else?
Used to wandering around.
I know that Erica from Cairns wanted to, but I don't know whether she's keen.
They said yesterday they'd send out a, they said they'd send out a note as to where it is, and they didn't. So I just.
Sweetie, can I just say that is like 10 seconds ago, we got the room and, sorry.
That's all I needed. To say. Yeah, I just
I've got a
wanted you,
headache now.
just wanted you to know that there was a. I didn't know what your role.
Oh, wrong.
Yes.
Wrong.
Sorry, just me again. Lynn, I've just had an email from Stephanie Alley wondering where you are.
Yeah, okay. And I
You
think
just let
because
me-
we haven't. So we're in 32, room 2.12.
32 room point
2.1.
2.12.
1-2. Great, okay. Thank you. I'll email her now.
Thanks, Susan. Oh, yeah, look, it was this
Yeah,
morning
no, I
thing.
didn't know. All of a sudden I was sitting there, I'm supposed to go to this. I don't know where it is. They said to call you.
Well, yeah, I've been away all last week, as you know. So,
Yeah.
Oh, headache. I'll be right. Lunch.
Yeah, just relax.
Can't relate them too much. Get fun. I'm seeing how good it's going to happen on them. Is supposed to be?
Cool.
Yeah.
So how are we going?
That's good. I'm very pleased. We managed that. Very pleased.
My brain's not working. There's too many
really
devices
interesting.
coming.
I looked at the clock today.
Yeah, yeah.
They're appropriate for.
I'm hoping to sort of get it regular, get a room, get a famous room.
So
Yeah.
we've still got about another 5 or 10 people to come in, so we'll give them another couple of minutes and then I'll start my spiel.
And then your face will appear on there.
When
So
I,
yours
we just have to turn
Thailand?
that
Are you
off.
all set? Thailand? I haven't even.
Oh,
So,
okay.
so once it turns on, we'll see them, but they
On
you won't see
weekend, so
yourself.
I'm going to Melbourne and directly to
So you'll be looking at yourself talking.
No, but
I'm
So,
not actually
yeah.
sure what they'll see at their end because every system's different. So
okay.
some will just see the slides, others will see both. Just depends on how it configures on their machine.
I see. So it won't be that people could see my face like I can see those people's faces there.
It depends.
Okay.
Let's find out.
I hope Stephanie.
Can everybody see the presentation and us?
Yes,
Okay.
we can.
Okay, well, there you go. That answers that.
Okay.
Cool. So we're just waiting another couple of minutes and then we'll kick off.
I'm working out how to mute us without turning them off. Us? I'm doing that as a mute. I think I've turned them off. Oh.
Got my phone forward into my mobile as well in case somebody.
The same.
I haven't found it.
Yeah, everybody emails me rather than.
So I might start talking now, just while we're waiting for the last few people to turn up. So we'll shut the door so we can't hear baby crying in the corridor. I know he feels like.
Just wait till you have to go to work, mate.
Makes me want to cry most days. All right. Thank you, everybody. So welcome to the final virtual seminar for 2015. We're always glad when it's our last one.
Oh.
But what we're very keen for people to do is to send us suggestions for next year. So if you know people that would be good to talk to ERA, if you've got visiting academics that you think are on a very relevant topic, something that's obviously of interest to the broader ageing research field, not just your specific tiny area that each of you works in, then please send us suggestions because we need good people to talk. Just want to remind everybody that the ERA conference for this year will be at the National Ageing Research Institute, NARI, in Melbourne on the 7th and 8th of December, so not long away now. Our abstracts have closed and we've got a good batch of presenters lined up for this year, nice wide range of topics. So really want to encourage everybody to come along. We've got two great keynote presenters lined up, Keith Hill and Liz Sciato, and we're doing two post-conference workshops, one on, it's not mixed methods, is it action research? Action research, and the other one on grant funding. So make sure you register and put your hands up for the workshops. The workshops are included in the conference registration. There'll be a new event as part of this year, the AAG Victoria, which our presenter is the president of, normally runs a rapid fire research presentation session each year, similar to the 3-minute thesis competition. So because we're doing ERA at the same time as they'd normally be running that, they've merged that into the ERA conference. So we've actually got a rapid fire presentation for, I think it's something like 6 people will be invited to present at the end of the first night. So that'll be quite interesting. There'll be prize money there. So that's great. It'll be the first time we've done that. So as I say, get on our website, make sure you register. Encourage everybody else you know to register, all your supervisors and senior academics and policy contacts and so on. Bring them along because the bigger the audience, the better. And it's a lovely, friendly conference. It's never a big one where we'd hope for something like 70 or 80 people. It's a boutique, friendly conference and people always love it. With the AAG, the Australian Association of Gerontology, we're running a joint workshop before their national conference in Alice Springs. So we're running a workshop on the 4th of November, looking at research translation. We've got a couple of great people lined up for that. So Sue sent emails out through the ERA network. It's on our website and so on. So if you're coming along to the Alice Springs conference, then make sure you come along to that Wednesday morning workshop as well. And finally, for a topic that everyone's interested in, the ERA Travel Exchange Scheme is currently open. That provides funding for doctoral researchers and people who have just, I think we've expanded it slightly to allow people who've just submitted and gone through their doctoral research to do a 6-week research exchange. So to actually go and work with an organisation, either in Australia or internationally, and do some decent level work, to actually have the time to sit down and get some stuff done, get some conference presentations done and so on. So we offer up to $5,000 for a local exchange and up to $10,000 for an international exchange. Applications close at the end of the month. If you're interested, start thinking now, because it's not an easy thing to get organised, because you actually have to identify the organisation, you have to get a letter of approval from them that they're willing to host you. You have to identify the work that you're going to do. We normally do it in combination with a conference presentation, so let us know where you're presenting. There's quite a few ducks you've got to line up, but we've already got, I don't know, quite a few applicants so far.
Around 40.
Whoa, 40. All right, so we're in trouble. Nobody else please apply. Way too many. So it's really good. I mean, it's taken a bit of time to get people to understand what it is. So a couple of years ago, we only got as many applicants as we had places available. So that was a beautiful time to apply. Last year, we had to do a small judging. This year, it's obviously we're going to have to do quite a detailed analysis, which is great. It means that people are realising just how useful. I'd love to have $10,000 to spend 6 weeks overseas. So have a look, and if you're interested, put an application in. So for the session today, we've got a good turnout. We've still got a few people coming along. I think we're not quite all there yet, but they'll come. We've got about 30 participants. And thanks to the Zoom technology, we're accessing you wherever you are, whether you're in a university node or at home or whatever. So that makes it so much more flexible for us to be able to connect to people. I will, once we get started, I will mute all your nodes so that we can't hear you moving your mouse or picking up your cup and so on, so that the only node we'll have is the current one here so that we can hear Jane. But if you do want to speak, are you happy to take 1 or 2 questions during the actual presentation? So if you've got burning questions, raise your hand or click on unmute, and we'll hear you. But otherwise, we'll leave the questions to the end. I may not see you because we have more little boxes than we have a capacity to show on the screen. So particularly if you're putting your hand up and I can't see you, then unmute and say, Matthew, I've got a question, and we'll go with that. But as I say, we'll leave the burning stuff to the end. If you can, just in case, please turn your mobile phones to silent, so that way, if you do happen to speak, we don't hear the dreaded ping. And please be aware that I'm actually recording the session. Because I tend to forget to turn the button on, I've already started recording the session. We do this so that we can load the presentation up on the web for people who can't see it today. So if there are things you've got to say that you think are a little bit too confidential, then my suggestion is don't say them, though I don't think in this case we're likely to. We had an interesting one last time where we had end-of-life issues where it was quite a difficult set of questions, and people were quite open on what they were talking about, but that was a point where they needed to think a little bit about it. But in this case, that's fine. So I'll now briefly introduce Jane. Jane's been involved in previous ERA conferences. Sue's just locked herself out. Including helping to convene the 2009 conference here in Melbourne a few years ago, and providing regular AJA publication workshops for us and for AAG at different points. So we've got one this year at the conference in Alice Springs. So many of you will know Jane through that, if you don't already know her through all her hard work in the AAG, having been a long-term member of the AAG. I'm really, really pleased to have Jane here. Jane's had a long involvement in teaching and research in gerontology for the past 20 years. Her area of expertise is healthy ageing, and especially physical activity promotion. And the aim of the presentation today is about an overview of the evaluation process, because when Sue and I were talking about what should be our next topic, we thought this one was a really important one, because so many of us have been asked to evaluate programs as part of our work, and we may not have been specifically trained in that. And you start trying to make it up from where you're at and so on. And I know that this is a lot of what Jane's done for much of her career, and now as a consultant, this is your payday. So Jane's going to give us her insights, highlighting some useful methodological tools, and really trying to make use of what all of you will have as your basic knowledge set. So we're not trying to bring you into a completely new world. We're trying to provide you with a framework that you can make use of in whatever aspect of research in the ageing field you happen to be in. So welcome, Jane.
Thank you, and hello to everybody wherever you are. I believe we've got someone here from Malaysia as well as from Australia today, so welcome on board. And certainly I'll take up on what Matthew is saying. I think that you'll find quite a lot of what I say today familiar to you. I'm really looking at what the similarities are between what we call research and what we do in terms of evaluating programs. And I think that you will probably have quite a lot of the skills in your research areas that I'm going to be talking through today. From talking with Sue and Matthew, I understand that some of you are well and truly ensconced in academia. Others of you have perhaps come into academia for your qualifications, and you're working out in different aspects of our society, dealing with older people. And so I hope that in both regards, what I say today will be useful to you, if not in your current role, perhaps in future roles. So could I have the first slide, please? And I apologise, I haven't got any pretty pictures in my slides. You're going to have to put up with my voice. But hopefully the things that I'll say will inspire you and make things clear for you.
You're pretty enough to compensate.
I know they can't see this beautiful woman in front of you. Okay, so these are the things that I'm going to go through within this talk today. And just to give you an idea of what we mean by evaluation, largely in the sort of health program evaluation setting, why we want to do it, what sort of approaches we might take, what the different levels of evaluation are, some of the frameworks that you come across in dealing with evaluating programs, and just make mention of program logic, and obviously give you some examples as we're going along. Because I think that you can delve more deeply into some of the things that I'm going to be talking about, and I know Sue sent you out a reference list, so by all means have a look at that in due course. Really what I'm doing today is just giving you a taster for some of the issues. Next slide.
Somebody I need to mute.
Okay, so I always like to start off with the definition, and so this is one which incorporates statements from a number of sources. But you can see highlighted there, the really key thing here is the systematic collection of data. I've come across people over the years, and I've said to them, "Oh, that's a really interesting project that you're doing. So why are you doing that?" And I've had various responses. Some people have said, "Oh, well, we got a bucket of money and we thought we'd look at something." And I thought, well, lucky for you to actually got a bucket of money, because it's always a highly competitive arena, and to be provided with that resource is something that I think a lot of us would be jealous of. And then I've asked them, well, how are you evaluating what your project's doing? And they said, oh, well, it's a good idea and everybody seems to be happy about it. Which means that, yes, you've got some anecdotal evidence, but we can do far better than that, and we can do so by systematically collecting data, and ideally doing that from the outset in terms of the designing, the developing, the planning of a program. So I see that even if you're excuse me, in the service delivery domain, evaluation gives you an opportunity to value add to the routine data collection that you would be doing, perhaps purely for reporting requirements. Those of you that have been gathering data for research, I'm sure if you've come across some of the challenges of dealing with data that other people have collected that you're trying to use for your purpose. And you can see that there are difficulties that if it's being gathered for somebody else's purpose, it might not actually meet all of your requirements. So if you're setting the framework about what it is that you want to, and what the questions you want to answer, and the data you want to collect, then that really helps. So people always feel it's a bit of a burden to be gathering data, for other external purposes. But if you could actually use that process to say, well, what can we actually learn from that information ourselves? So let's move on to the next slide. So these are the sort of key, sorry, excuse me. These are the key questions that you might ask. Is your program operating as intended? Is your program doing what you intended to do? Is it achieving what you intended to do? And you can see that unless you're actually developing and designing and planning in the same way as you do when you're doing a piece of research, you're not going to be able to ask these questions appropriately. And I think the distinction between evaluation and sort of scientific research is captured in this statement here. So evaluation as a process can optimize knowledge translation by determining how to implement evidence-based interventions under real-world conditions. We know that scientific research can indicate the effectiveness of particular interventions in tightly controlled settings, but to have widespread impact, the intervention needs to be moved on into the policy and practice arena. This area is sometimes referred to as implementation or translational research. Basically, we need not only evidence about what to implement, but also information about how to implement in a range of real-world settings, and that's where evaluation comes in. So that's a bit of the divide or the commonalities between sort of scientific academic research and health program evaluation. Evaluation really is a way of optimizing knowledge translation by determining how to work in those real world conditions. It focuses on implementation strategies and processes. It can address questions related to program reach, fidelity, and sustainability. And then this knowledge helps us to see whether or how programs can operate in various settings and populations. Similarly, we can't always wait for research before we introduce health programs. Services might not be based on theory or evidence. Nevertheless, there's no reason why, if you're going to be setting up any health program, that it should be influenced by a review of the available literature. So it's not a cop-out for if you're doing an evaluation of a program or a service that you're not going to look at the literature. That's still a very important step. Even if you're not actually testing theory, and I'll say a little bit more about that in due course, there's scope for you to systematically assess whether the program is achieving its intended goals. And this requires planning and strategic collection of data. Lack of evidence doesn't excuse lack of thought and rigour in the process of conducting an evaluation. Now, as in any domain, funding and time constraints may limit what can be assessed, but an evaluation can usually be scoped so that you can assess key elements of a program. The decision on where to focus should be made by and with key stakeholders. Now, the data that's collected will have similar methodologies and similar measurement tools might be used as you are familiar with in research. And just to go back to what I was saying earlier about if you're already collecting data for reporting purposes, you can be strategic in your use of that data to say, well, what can we get out of that data for our future planning of our service here? Can we have the next slide, please? So, why evaluate and when to evaluate? I think you've already seen that if you've got a program that's got some funding attached to it, I think you're ethically, as well as from a business perspective, obliged to be seeing whether it's actually achieving what it's intended to achieve. More and more, we're going to be asked whether something's cost effective. We're also looking at quality assurance. So those are the things that I'm sure that many of you are familiar with in service delivery sector. But historically, evaluation's been seen as an add-on activity. It's seen that you get a bucket of money and people say, oh, and at the end we'll spend X% or X amount of money on doing an evaluation. But clearly, if you're going to evaluate properly, you need to be thinking about evaluation from the planning stage so that you can make sure that the process that you put in place is actually going to help you to see whether what you're doing is what you've intended to do. Next slide, please. So I hope you can see some of those distinctions already emerging between research and evaluation. It's not like they're completely different things. It's just a slightly different slant on looking at a particular problem or challenge or an intervention that you're going to put in place. The difference is probably in terms of the concept of efficacy as opposed to effectiveness, and I'll cover that as we go through when we're talking about the framework, so I won't dwell on that so much here. And to reiterate, it's really looking at what works in the real world and how it works and why it works. So it's very much about translating findings perhaps of previous research into practice in a particular setting. Next slide, please. Now, I'm not quite sure how well you can see this, but I think you've been sent a PDF, so you'll be able to perhaps look on the PDF if it's a bit difficult to look at the slide. And two things as we go through this, and I'm sure the different stages will be familiar to you. Program evaluations can fall or be suboptimal because of 4 problem areas, and Woli has described those, and you've got the reference on your list. One is, if you take that box at the very top with a what, one problem can be lack of definition of the problem to be addressed, the intervention, its expected impact on the problem addressed, or what the expected outcomes are going to be. There can be a lack of logic, of testable assumptions between the program, its impact, and its outcomes. And we'll talk about that as we go through here. And in order to be able to get that logic happening, you need to have all that stakeholder involvement so that you can have a common purpose and that your aims are clear. You've worked out what your available resources are. Again, making reference both to the context in which you're working and to the available literature. Then moving on to the how, and again see the similarities with with research process, designing your evaluation strategy, choosing methods, and I'll talk about those elements of level, approach and framework shortly. Then making sure that your data collection methods and the tools that you use are going to ensure that you get useful results, things that will answer the questions that you've posed. Then, as again with research, collecting the data, analysing it, interpreting it, recording the findings, reporting those and disseminating them. So that some of what I'm going to be talking about can come alive a bit for you, I suggest that you just spend a minute or so now thinking about a project that you've been involved with, or a health service program, or a program related to older people that you've worked on, and some of the key activities that's been involved in that project, what the resources are, staffing, the different things that you've implemented, and what the key results have been, or what you've intended them to be. And then perhaps that will give you a bit of a mindset as we're talking through some of the examples. So I'll give you some that are based on my area of interest in terms of physical activity promotion in older people, but it's perhaps sometimes easier if you're thinking about it in the context of something that you're familiar with. Now, hopefully this is a fairly straightforward activity for you. And those of you that are particularly astute would perhaps have noticed that I said that there were 4 problem areas when you're planning and running a program evaluation. And I've only covered 2 of them so far. One of them was lack of definition, and the second one was lack of logic. The third one is a lack of agreement on what the priorities and focus of the evaluation are. And because you've just written things down as individuals, you know what you're thinking about. But if you to put that to the test with other stakeholders, would they be putting the same things down about the project that you're thinking of? And it's a perennial problem that people don't necessarily agree on where the evaluation should be focusing, what the priorities are. And quite often you're working within a limited budget or a limited time frame, and so there needs to be some agreement on that from the outset.
So that's different to your first one of lack of definition, because you've got clear definitions, they just happen to be competing.
Yes, competing, yeah. Or the problem hasn't been defined sufficiently specifically. Yeah. And then the fourth one is an unwillingness or an inability to act on the evaluation findings. And so it's always important when you've done a piece of work, not only to report on it and disseminate it, but I think also to advocate for those findings to be implemented. There's no point in having a whole load of recommendations in a report if people aren't going to take any notice of them. I always find that the key element of working up some recommendations, I always do that in conjunction with the key stakeholders so that we can test how feasible those things are. There's no point in making recommendations that people are really not going to buy into. So that was the fourth problem area. Moving on to the next slide. Okay, so there are 3 levels that are talked about in terms of evaluation. And as you can see down at the bottom there, I've said that quite often an evaluation program will be involved in a mixture of these things. But I think with any area, you know, if you're not familiar with it or you've only come across it occasionally, don't be put off by the sort of technical terminology when somebody says, oh, is it a process evaluation or is it an impact evaluation? There's obviously a lot of literature behind these, but in simple terms, I'll go through what these are, and you can see how there might be some overlap between them. And the level of evaluation tends to be driven by the purpose of the evaluation. And the focus might depend upon the status of the program, whether it's in a development phase or an implementation phase. It might be demonstration project where you're testing things out before it's rolled out. And the second aspect of determining focus might be to do with the timing of data collection, whether you're talking about collecting data before, during or post implementation. And again, ideally it's best to do it at all stages, but you might not have that possibility. So process is looking at more of the formative element of evaluation. So if we can have the next slide. I'm sure you're all familiar with, in terms of assessment, having formative and summative assessments throughout your courses, perhaps, things you've studied for. Process evaluation, that shows you the different things that might be measured. It's really giving you an idea about how how things are being conducted as the program's being rolled out. What the program's reach is it being rolled out according to a protocol or guidelines? What's the quality of how the things are being put in place? What's the capacity of the service to actually provide what it is that you're trying to do? What's the overall satisfaction of people both receiving a service and operating a service? So to reiterate, both formative and summative evaluation could occur. So let's just have the next slide. This gives you the 2 elements of summative evaluation. So you have impact evaluation, which by and large measures the immediate effect of an intervention, looking at factors like you can see there, or an outcome evaluation where you're looking at the longer term impacts of a program. And as you're going to see when I talk about hierarchies, sometimes people have only got the capacity to look at the immediate impact of an intervention, and that might be because they're only funded to do that. But they're trying to see those sorts of change the world goals, which you can only really do by doing a proper outcome evaluation where you've got some longer term follow-up of the impact of your intervention. Now, summative evaluation alone can miss out on the data available during rollout, and that data can help to explain why a program has achieved or not achieved its outcome. And that's one of the, I think, frustrations of our classic randomized controlled trials. We can see perhaps in the literature that something's worked, but it's worked in a particular setting, under particular circumstances. But from academic writings, we don't necessarily know what those contextual things are. Whereas in a health program evaluation, ideally you'll be getting that formative data to try and work out what are the things that have helped the program to work or not work, as the case may be. So we'll move on now to look at different approaches. This relates to how the evaluation is conducted. And I've really just listed here a number of terms that you might come across. And again, it's a bit like we talk about mixed methods. These might be a sort of focus for a particular piece of evaluation, but the literature will refer to these different terms, just so that you're familiar with them. Now, as I was saying earlier, there is some overlap between the various approaches, and the emphasis and the tasks associated with each type of evaluation will vary depending on its nature and its purpose. I think most of these terms speak for themselves. So needs-based, where you're planning something to meet a particular need. Utilisation focused, where people have said we want something that's going to do this, so that we could use it. That's quite often when governments provide funding for a particular program, that they want something to be put in place, they want something to happen. Collaborative or participatory, well, hopefully all of them are going to be collaborative or participatory, but this sometimes relates to the extent to which the people operating a service or a program are involved in the data collection, as well as in the consultation about how the program might operate, as opposed to having someone like me as an external independent evaluator coming in and doing all of the data collection and analysis. And I guess that's akin to in action research, where, participatory based research, where you involve the people who are actually delivering, using the service in the development of that service and gathering data about the service. Objective based, that obviously speaks for itself. Theory based. Now you will all be as PhD candidates and the like, you will have had plenty of conversations about theory-based approach to your research. I'm not talking here about theories like the theory of planned action or anything like that, although you may well be testing a theory within evaluation, or it may be part of your framework. But a theory-based approach is one where the evaluation is based on program theory. So this is how we think the program should work, and it's to do with the logical relationship between the program inputs, what you're doing, what you're implementing, and the program outcomes. I'll say more about that as we go through, just so that you can see what that term of theory-based is. Realistic evaluation, and I really encourage you to read this book, because again it goes to the issue of context. The context in which a program is implemented can really influence its success or otherwise. And the people that are proponents of realistic evaluation help people to really, I suppose, be realistic about, well, this is what our program should be able to do, but we need to be aware of what our program isn't intended to do and the things that we can't control for. You know how in a randomized controlled trial, the setup there we're making, we're trying to control for anything other than the intervention that could create, explain the outcomes. And the rest would sort of count as sort of background noise. It's a similar sort of situation here, but obviously within evaluation, unless you are randomizing people to receive the intervention, and often that tends not to be the case, you need to be able to account for and control for a lot of that background information as much as you possibly can. Be aware of what you can control, be aware of what you can't control, and what influence that has on how you interpret the findings from your program. I'll show you the next slide. Again, you probably need to refer to your PDFs here to get the idea of what's happening. This goes back to, I think, regardless of what any type of evaluation you're doing, stakeholder involvement and engagement and understanding is really critical to the process. Even down the years, I've been mistaken in taking on board what some stakeholders have said. Oh, we can't possibly get everybody in the same room together. I will liaise with those people and we'll make sure that everybody's on board and understands what we're doing. But I think this cartoon shows that the dangers of assuming that everybody knows what everybody else is wanting and everybody else is talking about. So you can see that it's very important that all the key stakeholders know what the purpose of the evaluation is, know what it is that your objectives are, know what you're trying to achieve, knowing how you're going to do that, what you're going to be able to do and what you're not going to be able to do, what the time constraints are, who's going to be doing what, who's responsible for what, and what the goals are of a particular evaluation. Because it may be that in determining the scope, there'll be other pieces of work that you might have to do afterwards, or there might be other bodies that are doing complementary work either at the same time as you or down the track. But you really need to know what the scope is, and everybody involved needs to know the scope. Certainly you'll have encountered this perhaps doing research projects, going out into a service sector, that people are involved in delivering a service, but they need to understand why you're gathering data from them. Otherwise, that data might not be gathered in the way that you intend it to be. Okay, I'm just going to go on to the next slide. And I take up on that point about what is your project doing, and really being aware of what the snapshot is that you're trying to take. So if you look at the stuff on the left-hand side of this diagram, this is the program chain of events. You see this is sometimes called a theory of action. And if you start reading from the bottom upwards, this is a program design hierarchy. So you've got the inputs, the activities, participation, responses, knowledge, attitude, skill change, practice and behaviour change, and end results. And I've kept that very generic because that's the sort of big picture stuff. And down the right-hand column, again, we'll start at the bottom. This is the sort of levels of evidence. This is what have you got in place? What do you need in order to be able to see what's happening? So this is your evaluation criteria hierarchy. And this table is based on work done by Bennett many years ago, and you'll find that in the pattern reference on your list. So here you have the inputs. So what are the resources that you need for the program, and also so for the service delivery and for the evaluation of it, depending on whether you're doing it in-house, whether you're involving external people to evaluate with you. You need to have data on what your program does and what it offers, characteristics of who's taking part in it and who's delivering it, then feedback on the program, you see that. Then you get to the next level up in terms of what your outcomes are, looking at changes, both in individuals and groups, looking at whether people have actually changed their behaviour, and then looking at those much broader issues about what level of impact has there been on an overall problem, whether there's been any social and economic consequences of the programme. So hopefully, when at this stage you're thinking about those projects or programmes that you wrote down earlier, just to contextualise this for yourselves. Okay, well, let's just go on to the next slide. This is I suppose, a very simple template of that construct of having a hierarchy of activities. And this is just in terms of the rows of this table. I've kept it very simple, so you only got the first row here, but you can see how you might populate the other ones. So this gives you some wording. So in order to achieve our goal, we require, yes, we need money, we need staff, etc. Activities. So the first thing we need to do is perhaps conduct a needs analysis. It might be not just, it might not be a good idea. It might be that we need to know a bit more about what's going on. Outputs. What evidence will we have that at the end of the day, where we're going to get those from? And again, hopefully you've seen that this is familiar with those of you that are involved in program management, where you've got to have KPIs in place. There's obviously some key similarities between that commercial business management model. And impacts, looking at the more medium-term effects of your activities, and outcomes in the longer-term responses. So things that you might look for there. Now we're going to move on to looking at frameworks. So next slide. There are a whole pile of frameworks, and this is really just so that they enable you to plan, develop, implement, and evaluate programs in a systematic fashion. Now, my favourite is the REAIM model, and I'm going to focus on that, and I'm sure that some of you will be familiar with it, so please bear with me. I'm going to just talk briefly about a couple of other frameworks. There's not as if there's a right or wrong framework. Some of them will work better for you, or some will work better in different contexts. So let's go through, and there's more information about these within your reference list. So next slide. So talking about the proceed model. This was developed in the 1970s as a cost-benefit evaluation framework to help health program planners, policymakers, and other evaluators to analyse situations and design programs efficiently. In the framework, health behaviour is seen as being influenced both by individual and environmental factors. So you can see I've underlined where the acronym comes from. This is more, I suppose, at the individual level. So what are the predisposing factors? What you're going to have to do to reinforce perhaps the behaviour, and what's going to enable that. So this is very much a diagnostic tool before you even go any further. I remember one of the PhD students that I had came along, and she'd done all the sort of research methods work, and she said, right, I'm going to do an RCT. I've been working in this aged care facility for years, and I know what the problem is, and I'm going to do this educational program, and that will solve things. So in a nutshell. But over time, with doing a lot of looking at the context and the literature, realised that probably some of the underpinning issues for both the residents and the staff, she wasn't as familiar with what was really going on as she might have anticipated. I think some of you might be familiar with that idea. And to cut a long story short, she ended up doing very much a qualitative piece of research to be able to understand where the residents and the staff were coming from. And then, as part of her postdoc, she went off and she actually did the trial that she was going to do in the first place. And that was all because of a really good diagnostic process. So proceed, so don't rush in. Don't rush in is the message there. So the next slide is proceed. This is looking more at the bigger picture, so beyond the individual to the environment, and looking at the policy, regulatory, organisational environment in which the programme, the service is going to be operating. Now, this project framework, you might find it useful to use. Some people have criticised it for being medically oriented, I suppose, because of that term diagnostic, but in other parts to it. Have a look at that. The next slide, please. This stands for, you see, SIP stands for context, again, environment, input, we've covered that, process, what will be done, and the product, how the program's effectiveness or success will be assessed and judged. This is a very simple framework, and it's certainly being used in health promotion settings. Compared to REAIM, which I'm now going to talk about, it provides less guidance for planning the programme, developing the questions and the objectives. So without further ado, let me go on to the next slide, which is REAIM, and take you through that. So that's what REAIM stands for, and there's a huge website of resources associated with this framework. So I'll just touch on what those things are today and give you an example, but it's certainly been widely used in public health domain for development of programs, to help with the implementation of programs, and to evaluate them as well. So next slide, please. So REACH is looking at an individual level of whether you've actually got to the desired target audience. And clearly that brings in questions to do with accessibility of your programme, equity of delivery of your programme, how useful the programme is. You might have a beautiful programme, but nobody can access it because they haven't got any transport, or you might have something that's really good, but nobody knows about it, so you don't get any throughput. So REAM, you can see how REAM helps in terms of thinking those things through before you set something up, but also assessing it as you proceed and as you complete a piece of work. I'll talk about an example, which is going back quite some time, when I was involved with the Active Script program. Those of you that have been around a while perhaps remember when there was funding for GPs to provide a script to their patients to encourage them to take physical activity. And that project was evaluated using this model. And in terms of the reach, it was the intent of the project is probably to get to sedentary people, but not surprisingly, it attracted some people who were already active, who were already keen on the idea of being physically active. So there was less scope for them to improve. So when their findings were put in, that probably diluted down the effect of the project. But if you knew that was happening, then you could account for that in how you interpret the data. Let's move on to the next, which is efficacy. So this is making that distinction between efficacy or effectiveness. So efficacy is really telling you about under very having a very targeted position, population under very specific conditions, what the value is of an intervention, both, does the benefit outweigh the harm of whatever you're doing. I think very much when we're talking about things happening in the health sector, you're really looking at whether something has achieved its desired outcome in the real world, sort of in everyday circumstances. Next slide, please. So, in terms of the Active Script program, people were certainly receiving advice, and we had some way of seeing that they were acting upon it too. Let's think about adoption, and this is akin to REACH, but it's looking at a settings level. And in that project, it was the Active Scripts program was more taken up by people working in multi-partner practices rather than by solo GPs, and not surprisingly more likely to be taken up by GPs who are interested in physical activity themselves. So that's the sort of information that you need to consider. I've put up there workforce recruitment and preparation, because you can see if you're using this framework in the development of a project, you can offset some of those problems about, are you getting through to a heterogeneous group of providers by who you actually recruit to gather data from, to run the services for you. And how you prepare them in terms of educating them and letting them know what's going on. Next slide, please. Okay, so I think the key words here are implemented as intended. Clearly, you want something to be implemented safely, appropriately, and you need to have an idea of the users and the providers' experience of the program. In terms of Active Script, it's interesting that our findings were that not that many of the GPs were actually handing out scripts. So that sort of, it seemed like a nice sort of fancy thing to do, but the good news was that they were actually giving their patients advice. They were creating that positive outcome. albeit on a variable basis across practitioners and depending on the patient's circumstances. But if you were just to measure the number of scripts that had been given out, you probably would have said, oh, this program didn't do very well. So that's the implemented as intended. It wasn't necessarily implemented as intended, but it had the intended outcome. Next slide, please. Maintenance. So how many times do we see that when a bucket of money finishes, then the project just falls in a heap? With the Active Script program, there were a variety of programs thereafter whereby GPs could be encouraged to advise their patients about physical activity, but certainly enthusiasm waned over time. And this is an important element of the sustainability of a program, because has it been embedded within your organisation? Has it been sufficient? Has the program made sufficient individual change take the example of physical activity, that person will continue to be physically active, or is it something that's going to peter out? So those are questions that are really critical to answer. So I'm nearly done, but I think we'll spend a few moments reflecting, and seeing as we're not having an interactive session, as I'm familiar with usually.
We can make it interactive.
That's right. Well, we can do it at the end. I just wanted a couple of moments for you to reflect on those aspects of reach, efficacy, adoption, implementation, and maintenance, and think about them in terms of that project that you wrote down earlier, and see how you would judge yourselves. Perhaps talk about some of these things at the end. Okay, so I'm going to finish off by giving you a very swift run through program logic. It's always challenging when you come across new terminology and it seems very fancy, but think about logic when somebody says something to you about how your washing machine is working. Well, that doesn't seem logical to me. And so that's what you should think about in terms of the word logic. It's perhaps captured in this following sentence. If the following program resources are available, then the following activities will be undertaken. If these activities occur, then the following outcomes will be produced. If these activities and outcomes occur, then progress will be made towards the following goals. So whilst you can't necessarily determine causality, you can see that there's a string of logic, there's a link between the different steps of your program. What you've put in place links by that next step to what you do, what you look at in terms of the outcomes, and those outcomes achieving the goals that are what you set out to achieve. So that has to be there from the outset so that you know what really all those links are. Next slide. This is based on a program logic hierarchy that's in the Funnell reference that you've got on the list. There are several forms, but this just takes you through. So across the top there, you've got the outcomes hierarchy. And you can see again, reading from the bottom upwards, that sort of short, medium term, long term outcomes. Success criteria. This is where you determine what will show that the intervention has achieved what it's intended. It might be expressed as a target, so 80% of people are aware of the existence of the physical activity recommendations for older people. That's what PA on this stands for. Sorry about the acronym abbreviation. We're all guilty of using these things. Factors in control of the program. So writing down the things that your program can do. What can you control? What's within your program's scope? And equally important, what's not in your scope and what can't you control? Program activities and resources. What needs to be done? What can be done? What are the resources available? And this is a reality check for you. Performance information comparisons. Again, those of you familiar with KPIs. So you've got indicators that might be quantitative, so percentages, or qualitative, so satisfactory compliance with the gold standard. Sometimes the findings, there's a comparator. We've talked about how we have that, some randomized controlled trials or case control studies, but here it might be a stated comparator of a different sort. You might be comparing by interpreting an increased awareness compared to prior to an intervention, so that's a positive outcome. Or you might be looking at improvement of X% or favourable performance against an industry standard or expert opinion, in which case that's a judgment, there's a value placed on it. Okay, so let's look at the next slide. So I've taken that bottom level of the table, so you can see that the outcome there is at the level of an impact, where older people seek out physical activity options. So then the next column shows you your target, and then the next one show you what is within control and outside of control of your program. OP stands for older person. You've got a column that tells you the things that you need to have in place, and then you've got your measurements at the end of that last column. Next slide. Now, I'm just finishing off with this to show you that that idea about stakeholders and what that means in terms of looking at objectives. This is based on some work that I did with others for the Australian government, and there are a whole pile of objectives, but I've just picked out a couple to show you. And you can see on the left side that there are patient objectives or consumer-related objectives. And one of those was to enhance patient self-management of their health via support provided to modify their behaviour. In this instance, physical activity, because we know that that contributes to chronic disease. And you can see, so CO means that that's a consumer objective. And you can see in brackets there that that objective is related to the implementation effectiveness part of the REAIM framework. So you can transpose that onto the hierarchy. And in the right-hand column, you've got a funder or an organisational objective, and this is at the level of making sure that something's being designed. The overall objective might be to develop a sustainable model of a support system or coaching program for people for chronic disease self-management. At this level of the hierarchy, this is just to be able to test something out for national rollout. And you can see FO, so that's the funder objective. And again, you can see that this is focusing on the maintenance and implementation elements. And on to the next slide. And this is very much for illustrative purposes, because there could be a whole pile of objectives, and they would be at different levels within that hierarchy. But I've just given you these to show you how you might go from some of those more immediate outcomes at the top down to the longer term outcomes at the bottom. And again, those are linked into what are the consumer-related objectives and the funder level objectives. And each set of objectives, obviously, you would look at what's the appropriate means of collecting data for answering that particular question. I'm not going to go into data collection because we're pretty much out of time, and I know that that's something that you've covered in other settings. But hopefully by now you'll be able to see, using this type of these frameworks and this idea of a hierarchy, how it's important to link your objectives to the data tools that you use and to the ultimate outcomes that you're trying to achieve. So I think the take-home message for today, just on to the last slide, thank you, is that with good planning and communication, any of the barriers to program evaluability can be overcome. Evaluation doesn't give final, unassailable answers, it provides direction.
I know what that is. Okay, that should be better.
There's always something, there's always something.
No, I'm running it in parallel, so I unmuted all. I forgot I unmuted myself. So we've got a direct feedback loop between that machine and that machine. So, open for questions. Everybody's unmuted unless you've manually muted yourself. So, questions away. If you don't want to start, I'll start. Someone want to beat me to the punch? So my first question is, you made the comment that there was a tendency for this sort of stuff to be considered after the fact. Is that changing? Are we seeing within government programs and so on? Are we seeing more evaluation being embedded in the first instance? Because you can see from the frameworks that you've got that if you work through those tables, try and understand what you want to answer at the end, your design at the beginning is going to make a hell of a lot more sense.
Exactly, yeah. Fortunately,
somebody's typing very, very loudly.
Fortunately, yes. There is still perhaps a propensity to put a very discrete figure on how much an evaluation should cost. but more and more these days, thank goodness, people are actually looking to consider the evaluation from the outset, and it makes for a far more productive process of service delivery, because as you hopefully have seen, it also influences the way that you develop a plan. And you might actually save money overall, because you might be able to scope your program sufficiently tightly that that you can achieve a real sort of bang for your buck. Whereas if you go into it with we'll evaluate using a survey without thinking about, well, you can give people surveys, but they've got to actually be answering the questions that you really want to address as part of your program. So yeah.
Well, I can certainly remember government programs in the past where the evaluation was talking to service providers
After the program's
you know,
delivered, yeah.
and at no point was it actually talking to the people who received the service to find out whether from their perspective it actually had any outcomes, any of that sort of stuff. And there's a certain bias embedded there. If you're asking the people who are providing the service to evaluate the service, they're going to say it went well because they want to do the next one. So, you need to have a far more rigorous approach to it. Are the funding bodies, stakeholders, someone starting to require this more?
I think so, yes. I mean, perhaps Liz would be able to say more about that than I would. But I think because we've got perhaps more public health practitioners working in government and NGOs, they're aware more now of the importance of evaluating. Because we know, as I said, you can read about an RCT that's being conducted, and then you go to duplicate that in your particular region, perhaps, and then wonder why it hasn't actually worked for you. And unless you actually know what was actually driving the success of a program, then you don't. You might be setting yourself up to fail from the start. So I think that's what I'd like to see. Not only that we have funding for evaluation for the whole process, but that the dissemination of the processes of what makes a project work or not is also disseminated.
Go for it. I can see a hand up.
Yeah, just a question regarding outcomes. Many programs are funded on such short cycles that really true outcome evaluation is just not possible.
Correct. And I think that's where you need to be clear. That's what I'm talking about stakeholders, because if you're looking to perhaps improve somebody's knowledge base, but you've got some stakeholders that are saying, oh, well, everybody's going to have much better stroke management as a result of this, then that's not within the scope of your particular piece of work. You can't. You might be able to look at how what you've done contributes to what's perhaps happening elsewhere, that can all come together to improve stroke management. But these things, it's a perennial problem that people think of these motherhood, let's change the world's outcomes, which you really can't do within projects that are bounded by financial and time constraints. But that's why it's important to say, you really have that scope, and so that you're not having false expectations. It's better to focus down on doing something really well as a contained project that will be able to influence and help you to develop further programs, rather than setting out to do something which is just infeasible, really. I don't think we're ever going to go to having 10-year funding projects.
Well, occasionally,
Yeah,
Do you think we might see some sort of recognition by mainly government funders, but that you may have a very short-term project that's done, but then to revisit maybe some time down the track and, gain a sense of what's happened over time since the project was done and ostensibly, stopped, how much was it taken into the daily procedures and protocols of organisations, all of that sort of thing.
Yes, and again, it might just be in my sphere of where I've been working, but there certainly seems to be that understanding. I recently was involved in looking at a project to deliver telehealth to save people having to traipse all the way into Melbourne from rural Victoria for what would be a 10-minute consult. And as with lots of programs, it took a long time to actually get different staff in the different regional nodes and get them up to speed on how to work the telehealth technology. There was always also the buy-in from the clinicians to do it. And so by the time I'd done the evaluation, really I had got a good handle for them on the process and some idea of the potential impact. But one of the recommendations was that ideally we need to go back down the track to see whether this is actually having the intended consequences. We were able to get some feedback from the clinicians and the patients about how well they were going with the technology and whether they saw it as a benefit to saving all that travel and such like. But you really do have to go back down the track, and I felt that the funders were at least open to that. But that was because we had the benefit of having that discussion up front about how much we were going to be able to see within time of the time frame of the evaluation component of the project.
I had a similar sort of a project, again, telehealth, where they found that there were positive outcomes. It was a very well evaluated project. And the issue that came up is that part you referred to earlier, what's outside your control. And this was the politics between the various health service areas, that it was led by one health service for the entire region. And they made it work, but then it came, once it was finished and the funding was finished, there was the question of, well, who's going to pay for the software to keep this thing going? And the internal politics got in the way. It fell over. And it wasn't because of any issues with the actual program or the evaluation. It was just, well, I'm not going to put my hand in my pocket. So it's challenging sometimes.
Can I ask a question about diplomacy, Jane? Because you said develop recommendations in conjunction with key stakeholders, which is a great idea. I'm just wondering what you do when a service really isn't, or a program really isn't up to scratch, and any recommendations you make are not going to be taken by, say, the government body or things like that, like how you present that kind of really negative feedback.
Fortunately, I haven't had much experience of that, but I think it perhaps goes back to the point we were making earlier about if you evaluate something internally, everybody is got a vested interest in it working, and that's why they bring in someone externally, so that if things aren't working desirably, that somebody is there to point that out. And so that, I suppose that would be my first point of reference, is that's the reason you got me here, to be independent, to give you an objective perspective on what you've been doing. And I think that most people are reasonably self-aware. People that you will, I think, if you've got a broad representation of the stakeholders that you're gathering data and feedback from, that you will be able to see that where there are some strengths and weaknesses and imperfections within a project. And it's not a matter of personalising it. And one of the key things is that the information is usually presented back to an organisation in a de-identified format. So you're just pointing out some of the issues where there is need to change things in order to improve the whole system. So it's not like you saying Joe Bloggs over there or Traralgon Hospital, or the people internally will know that might be the case, and hopefully they will do something about it. But when you're making recommendations, you duty bound to highlight both the positives and the things that need improving. I mean, I think that myself and others would have had pressure to bear on us to perhaps massage some findings, and you see that reported in the media sometimes, that people have been asked to say things when that hasn't, when it's really a interpretation of the facts. But you're going to be found out if you're not going to be objective and truthful. So
More and more research seems to be, evaluation seems to be collaborative as well. So it's not you coming in and evaluating the organisation, and it's a completely sort of separate lens. The project I was talking about, our school did the evaluation, but we did it in collaboration with the health organisation, and so their research nurse was sort of the coordinator for the whole project. So there were issues where there were major problems with data collection, major problems with the procedures being followed, with the computing being so out of date that you couldn't actually run this program, that sort of stuff. So there were issues that need to be fixed within particular hospitals in this case. But the fact that we ran it through that organisation meant they took the heat, and they knew what was going wrong where, but then it wasn't us sort of making comments about the health sector. It was someone from within the system. So at points she copped a bit of heat for it, but she also became known as owning that thing and trying to build capacity across the region. So I think more and more that sort of collaborative approach will work. It used to be the case that researchers always made this assumption that people in policy and practice didn't know anything about research. That's clearly not the case anymore. There's so many people with PhDs working in the space, or people upskilling and so on. So the people I talk with in the health department now are at least as smart as I am, if not twice as smart. So yeah, it's becoming a far more interesting and nuanced discussion. Any more questions? Okay, thank you very much, mate. I really appreciate it. It was really interesting, the example frameworks that you gave. I think are very straightforward. People can take them, use them in their own settings. It deals with that question of, oh crap, how am I going to evaluate this? Well, here's a basic framework, but obviously it gets individualised to what you're actually working in, but it gives you that really good start point. So certainly I took a couple of notes about the proceed and the re-aim. Your comment about a PhD project changing as a result of that. I've had a couple of conversations in the last month or so on a similar sort of line of, as the student gets to really understand what it is they're doing, well, actually, that's not the question I want to ask. This is, and it's a whole different approach to where they think they're going to go now. So very useful. All right. Thank you, everybody. As I said, the workshop coming up in front of the AAG conference. So if you come into Adel Springs, register to come and see us first. The ERA conference in 7th of 8th of December, and the ERA Travel Exchange closes in the next 3 weeks. So get your applications in if you haven't already, and make it really, really tough for Sue and I to pick through 60 applications instead of 40. Thank you, everybody.
Thanks.
Yeah. I'm so pleased that you were here in the room.
Oh, that's good. It was nice to be. I'm never with the presenter, so it was really nice.